But we begin today with the new normal as it applies to community health. And our guests are from the Matthew 25 Health and Dental Clinic. I'd like to welcome Emily Almodovar.
Good morning.
Thanks for coming in this morning.
Lee.
And then a repeat guest, Caitlan Krouse, nurse practitioner who volunteers at Matthew 25. Good to see you again.
Thanks for having us.
So tell me about how COVID has affected the population you serve, which is low income and those without health insurance.
Yes.
Yeah, so I feel like the biggest concern for me as a primary care provider for this population is the fact that a lot of them have really uncontrolled chronic illnesses, and I'm worried that that's been put on the back burner right now. This population already suffers from a lot of the things that the rest of us are realizing as a reality right now, meaning that they have a lot of trouble with maybe social supports and transportation and that whole idea of health literacy and how to actually access the healthcare system appropriately. So I always say, picture right now that you're somebody who doesn't have English as your primary language, and how are you trying to figure out what to do about that? Let alone managing your diabetes and your hypertension and stuff as a part of that. So I really worry once these patients start actually coming back in that we'll see that their diabetes is now uncontrolled or their hypertension is now uncontrolled. And what is that going to look like for them in their long-term health outcomes? That scares me.
And as we all know, those comorbidities and the increased risk that places them for a bad outcome if they are infected with the COVID virus. And we talked earlier about just the challenge of life for these folks and how everything is even more difficult now. Let's talk about the food insecurity issue.
Yeah, thanks for asking that, Lee. So we recognize that a vast majority of our patient population before the COVID pandemic, they were already dealing with housing insecurities and food insecurities, other stressors and toxic stress situations like domestic violence and things like that, homelessness. And so when you compound all of that, think about the grocery stores and think about a month or so ago when we were all hoarding food, or rather just simply stocking up for a couple of weeks. If you don't have the income or that buffer, that cushion to purchase another couple weeks of food, you were not able to do that. And then if you think about no transportation or carrying your groceries on a CityLink bus home, you are limited by what you can carry in that one trip. You can't make a couple of trips out to your car to fill your pantry. And so we recognize that those are some of the challenges our patients are facing.
In addition to the fact that you are living in a multi-generational household often, and so you've got the challenges of dealing with that older person who might be at extreme risk, along with, it's just a big mess for these folks.
Yes. Yes.
Yeah, and as we've mentioned, Emily says about using public transportation and stuff, and all of those trips out is putting you at greater risk. And so if you're relying maybe on your teenager in your house to go run these errands, but you're right, bringing them back to maybe the grandma who's also in the house as well, who does have uncontrolled diabetes and isn't able to go into their healthcare provider right now because all of these offices have been offering limited services during this time as we try to figure it out together.
And so the point I want to make, and I want to make it delicately, is that keeping these folks healthy is important to all of us. Let's talk about that.
Yes. So you can tackle the medical perspective, but from kind of a marketing and community relations perspective, when I would talk about what we do with folks, I always framed it out in the economics of it. If somebody with a chronic health disease can't manage that with medication, so they're going to the ER, every couple of months, if they don't pay that ER bill or they're not able to, then who eats that cost? We all do.
Sure.
And so in talking about the importance of Matthew 25, again, I've framed it out in economics. But now this virus has really sort of underscored how the health of each individual person affects the community health as a whole.
Yeah, and I even say beyond just the pandemic, prior to and then once we look forward, even 5-10 years from now, Indiana has always been in the bottom 10 states with health outcomes. And that's a reflection on our health policy protocols and our health infrastructure. And so we should care about individuals because it's a reflection on who we are as a community and who we are as a state, and that impacts our economy and jobs and all of those aspects that are important to every single one of us.
And now you've got a group of people who are under great economic stress. They have more motivation to go to work when they're not feeling great because they've got few choices and few and thin resources. So yeah, it's just, you look at the virus and the impact it has on this community, it's really extreme.
I think that is showing us, though, what is a normal for so many people on a regular basis, even outside the pandemic. So many of our patients live by paycheck to paycheck, and they have to work, their 12-hour shifts at a long factory, even when they're not feeling well, and they can't they don't have benefits, they don't have PTO necessarily associated with some of these jobs, and they're often working multiple jobs. So to take time off to come in to see us at Matthew 25 is problematic sometimes. So that's often why health outcomes end up going uncontrolled for a while, because people are prioritizing jobs and finances because it's what puts food on the table and pays the bills for their housing. And I understand that.
And the unfortunate circumstances at Matthew 25 in the past couple of weeks have made that problem worse, actually. You've been forced to close because of the COVID exposure in your clinic.
Yes. We do want to stress, though, that the number one concern for us was making sure that our folks who were on those critical meds that manage chronic disease had access to their medicine. So Parkview has partnered with us. They have been providing those critical meds during this 2-week closure. But it was a huge learning curve for us. We did not put our patients at risk. We were always wearing N95 masks, gowns, and gloves when we interacted with the public. But what we missed, the key feature we missed, was that our coworkers we had brought into that inner circle. And so now when we reopen Monday, we're still at a reduced hour availability and reduced staff availability. But when we open on Monday, we will be wearing masks with each other as staff. When we have a staff huddle in the morning, we're going to be observing social distancing. And so we really want folks to maybe learn from us as the economy opens back up and as other businesses begin to open back up. Be cautious and still maintain some of those same precautions with your coworkers that you would with strangers when you go to the grocery store.
Yeah, it's a learning curve for everybody, and I think that's an important lesson learned as people start to return to work.
Yeah, and that's the new normal. That's the kind of the phrase that we all have to kind of grudgingly accept and get used to.
Welcome back to Health Call Live. If you've got a question, you don't have to give blood to get the answer. Just call us at 447-1190.
And you can also shoot a text to 46862, and that is what someone has done. They sent a message in and said, why are we wearing masks if they really are, if the virus is so small, it can get out around the mask? And I think we've covered this before, but Caitlan, I know you wanted to jump in on this as well.
Yeah, I think the importance with the masks is the fact that at least it's giving us some protection. It might not be 100 proof, but if all of us are wearing masks to help prevent that spread, even if it's cutting down some of the virus spread and we're all washing our hands regularly, this can make a huge impact on our community. It's very important, and there's lots of research to support it. That's why it's a CDC recommendation now.
I don't like wearing a mask. It fogs my glasses, all of that stuff. But I've noticed that that mask makes me more aware of not touching my face and all of that kind of stuff. So yeah, I get it. It makes a lot of sense.
And I also, since I mentioned the N95 masks and that we have appropriate PPE at Matthew 25, I also want to focus on the fact that different types of masks have different grades. And so somebody who's working in healthcare, that N95 mask is good for 8 hours. Mm-hmm. If you're going into the grocery store and you've got 40 minutes to grab your things, you don't need that level of protection, where a surgical mask will give you 2 hours of protection, and then your breath has caused it to be too damp to be effective. And so, just understanding that each type of mask serves a different purpose.
So you have been closed for 2 weeks due to exposure of a staff member. And so you're coming out of the quarantine period, opening Monday at half hours.
Correct.
And so you're making news in that way. But also there's some great news for you this week with PHP with a $100,000 grant. Now, what is that money going to allow you to do?
Yes. So that $110,000 grant was a general operating grant for us. PHP Foundation, they're wonderful supporters of what we do. And as a general operating grant, I know a lot of different foundations and individuals love for their money to go towards a program. But for a service organization like ours, the quality and caliber of the staff, the cleanliness and the level of quality of your building, those are directly affecting patient care. And so these general operating funds help us manage the overhead, make sure that we've got appropriate staffing, and we're grateful to them.
So help me understand how you can provide medicine at no charge to people. Is this just being donated
We're
by
very creative.
Is it being donated by the pharma companies? Where's this stuff coming from?
Yeah, we've got several different avenues. So one of the big ones is these charitable pharmacies, the rise of these national charitable pharmacies. We work with Direct Relief, AmeriCares, and Dispensary of Hope. We are able to order bulk meds from them and then dispense from that. We have a budget for things that we can't get any other way. We have to buy lisinopril, for example. We have to
I don't know what that is. What is lisinopril?
A blood pressure medicine that's quite common. And I would say as healthcare providers, those of us who are prescribing at this clinic are very creative, and we most of us have been working with underserved populations for a long time. So I have the $4 med list at Walmart memorized. I absolutely, our pharmacy in there, the med clinic, is right next door. So I walk over there all the time and ask them, what options do we have today for an antibiotic? Or what options for inhalers do we have in stock right now? Mm-hmm. So we work very closely as prescribers with those who are staffing the medicines. So that way we can make sure that patients are walking out the door that day with what they need.
Yes. And then even the pharmaceutical companies. Almost every pharmaceutical company has their own charitable arm. And so we've got a department where we're writing applications for meds that might be too costly for us to buy out of our budget. And, certain insulins and inhalers, we're actually writing applications to the pharmaceutical companies, and they are giving those to us for free.
Those are the most expensive.
And so I know that you are always looking for donations from the community. If I go on your website, which is Matthew25online.org, I know I can donate right there on the website, and I hope that you will. But if I do, can I direct what my money is being used for? How do you use my donations?
Sure. Folks are more than welcome to sort of indicate how they want their money to be used, just like a foundation can indicate how they want their money to be used. However, if somebody can go to our website, find that donate page, that money right now more than likely will be used to restock the medications and supplies that have become critically low with the pandemic. So we have increased that dispensing supply for folks. If we gave somebody a 30-day supply of their meds in the past, we're giving them a 60 to 90-day so that they don't have to go out as often.
Yeah.
And so that's really reduced our inventory. So meds would be probably the number one thing that we would be doing.
And you don't know what's coming. I mean, with the unemployment rate at 14%, and I would assume that many of your population are in the non-essential jobs who have been laid off. We don't know how quickly those jobs are going to be coming back. There could be a tidal wave of demand about to hit your door.
Yes, we already have backlogs of new patients waiting for appointments, even on a regular basis. So this is definitely going to be a trying time for us. But I do think what people are often surprised to find out is that a majority of the patients that come to Matthew 25 do have jobs. You're right, though. They're probably not technically ones that are usually considered essential during this time. So most people are working at jobs where they're getting hourly payments, but not the benefits and stuff associated with it. So they don't have insurance, and they're still living under the federal poverty level because they're not still making ends meet like they would like. So then, you throw the pandemic at it, and it's really going to rock a lot of people's worlds, as we've seen.
Right. And leads, this has really highlighted how many folks rely on group health insurance through their employer. And so people who've been furloughed or who have lost their job through this, now they are finding themselves uninsured. And we do anticipate a spike in those numbers of adults who qualify financially for us and now do not have that group health plan.
That line of vulnerability for so many Americans is always a little bit gray, and that's really become evident during this time.
Yeah. So what about your clinical team? I think, aren't many of your doctors and nurses volunteers and in retirement, working in retirement? If I'm 67 years old and I'm going to put myself at risk, come back into the clinic, are you concerned about whether they'll be coming back?
Yes. So actually, this is a great maybe forum to have a call out for nurses, physicians, nurse practitioners. If people have a little bit of extra time right now and would like to volunteer in our clinic, we would love to have them. I'll let Caitlan speak to being a practitioner with this population. I'm sure it's rewarding, but we would definitely encourage folks, if they're able to come and volunteer right now, we would take them.
The clinic is primarily run. We have a very core group of awesome employees there, but for those of us that volunteer, the main functions of the clinic day to day are often done by volunteers, by students who are there learning. We do a wonderful job at Matthew 25 teaching future students in all different types of career paths, and that's all been put on hold. And so, I do think that the volunteers who come back will look different because people are still going to be taking their own health into consideration and the people that they live with. So hopefully for people who are able to volunteer, this is a great opportunity to start getting involved.
We are, though, as a small organization, we only have 32 staff members. We're pretty nimble.
Yes.
We're pretty agile. And so this concern with this tidal wave or spike, we will manage it as best we can. Our nurses right now, even though we're closed, all of our nurses and our nurse practitioners who are staff, they're all still doing phone nursing consultations with people right now. They're going to be triaging appointments. They're going to be triaging who we can get on the schedule. But for example, as an admin person, I learned how to do staff screenings and take temps. Our dental hygienists can't do cleanings right now. They've all stepped up and they've all learned how to do patient screening, and they've all worked sort of that front door. So I really think that we will adjust our staff to meet the needs of our community.
And that is the new normal. Healthcare workers are being pulled and non-healthcare workers into new roles.
Yeah, isn't that the case?
Yeah.
I didn't realize that I can help you in another way, and that is I can donate unused medications. I think people often feel guilty about throwing that stuff away, so it sits on the shelf. Now there's something I can do with it. Help me understand that in 30 seconds or less.
Well, and not only unused medications, so especially ones that have never been opened, maybe a family member passes away. That's often a common time where somebody donates, but also a lot of equipment too, things like TED hose, which are those stockings that help with swelling in the legs, or catheters, all sorts of random things that people might have left over that we use and give out to patients on a regular basis. Walkers is another one that I'm always looking for.
Shower chairs.
Chairs.
Yes.
All sorts of things. So it's not just medicine. It's any kind of healthcare equipment that might be useful.
Unused, unopened, unexpired. That's important.
Okay, the 3 uns, if you have anything in your cabinet that fits that criteria, they can use it at Matthew 25. And if you'd like to help out, you can always go to Matthew25online.org and you can donate right there. Good to hear that you're going to be back open on Monday.
Thank you, Lee.
Thanks.
That's Emily Almodovar from the Communications Manager, and Caitlan Krouse, a volunteer nurse practitioner at Matthew 25.